So we're going to pick up now with the second half of our patient care procedures lesson series. And we ended last time quickly moving through some of the overall rules and regulations concerning the treatment of medical waste and disinfectant and the prevention of pathogen transmission. And so in the second half, we're going to specifically look in more detail regarding how we can go about doing that. And we're going to focus now on these four things here: cleaning, sanitizing, disinfecting, and sterilizing. Right? We talked already a little bit about cleaning in the housekeeping things as far as removing dirt and soil with that, but not killing them. And then we'll move through with sanitizing. It's going to be lowering the number of bacteria. Disinfecting is going to be killing all that, but not necessarily bacterial spores. And then sterilize is killing all microorganisms. So let's go ahead and take a look now at specifically what we are doing when we're talking about sterilization and disinfection. As we talked about before, air and all objects contain microorganisms. That's nothing new. We've been talking about that before. And so we are responsible as healthcare providers to help reduce and eliminate those microorganisms. And we do that through these process of medical and surgical asepsis and decreasing or eliminating all microorganisms within an environment. And we obviously do that using a variety of physical and chemical agents throughout the care procedures. And then those chemicals often are hazardous. So before we get into looking at sanitization, disinfection, and sterilization, we have to take just a quick detour to once again talk about some specific requirements within that. And the first one is the Hazard Communication Standard. Again, this is an OSHA requirement that all employers that have employees with interactions with hazardous chemicals develop a hazardous communication program, right, and create all of these different aspects. And the purpose really is to ensure that those employees are informed of the hazards and then they have the ability to deal with those hazards, right? And so we'll talk about each of these specifically with regard to what the requirements are within this hazard communication standard. So the first one is a communication program, and this is similar to the other trainings that we saw with regards to bloodborne pathogens and different aspects like that. There has to be a written plan associated with that, and then need to be available for all employees that are working with them. So you can see things like these hazard communication aspects, and this forms the backbone of the standard. Inventory of chemicals. So all of the chemicals that a employer has on site and that are being used need to be inventoried with regards to including their name, the manufacturers, the ingredients, specifically the hazardous ingredients, and then the health and safety ratings of that chemical. And if there are new chemicals that are introduced to the workplace, that has to be updated in the inventory. So this should have a comprehensive look at all of the different chemicals that a employer has on site. In addition to having an inventory of that, all hazardous chemicals must be labeled, right? And the manufacturer must label these chemicals as hazardous, right? And that label then is included within the packaging, so that can be seen. If that label were to fall off or become damaged, a replacement label must be applied. And within that aspect, it also needs to be added to any transfer to a new container. So if you transfer a chemical from one container to another container, you must include that label within there. And that label has to include the things like the possible hazards, steps to protect against risks, and it can be done in picture or written form. And so you can see here's an example of a couple of a label and then the pictures that go along with it. So every label must include the name of the chemical. All right, so here, the manufacturer's information as far as their complete name, address, and emergency phone number, any physical hazards associated with the chemical. So if there's a potential for the chemical to catch fire, react with other chemicals, explode, all of those then go into these different pictures that you can see. So like flammable, corrosive, oxidizers, gas under pressure, explosive within there, and you can see those are included within those pictures. There also has to be health hazards of the chemical, right? So what is the potential of this chemical regarding irritation to the tissue, cancer, sensitivity of reactions, toxic reactions, corrosive reactions? All those different specific health statements need to be included on the label that is on the chemical. And then safety precautions also need to be provided within that label. And so you can see here how to go about treating different things, how to avoid exposure, how to safely handle, store, and dispose of the chemical. All those sorts of things need to be included on that label. And like I said, if that label was to become damaged, it needs to be replaced. If a chemical is transferred to a different container, then a new label must be applied to that additional container. The other important aspect is because obviously within a label you have a limited amount of space. So in order to help create a more comprehensive system associated with the storage, handling, and potential dangers of chemicals, the employer must also have available the safety data sheets. And so you can see how much more comprehensive the safety data sheets are. And these need to be written out and kept on file in a place where the employees can get that. Right? So in that, it has more detailed information on the hazards, measures to prevent injury and illness, obviously with that, and some additional aspects within there. Now, there is one exception, and this is the household consumer use exception. If there is a chemical that is being used in the same way as it would be used within a normal household, you do not need to keep a safety data sheet on file. So example of that would be if you have like drain cleaner, right? To clean out drains within your medical office. That's the same way you would use it as at home in a normal environment. However, things like bleach that might be used to decontaminate blood spills, that's not a normal everyday consumer application of that, and so you would need a safety data sheet for that as well. Within that safety data sheet, then, you need to have specific things associated within that safety data sheet. And these safety data sheets are usually provided by the manufacturer. You just have to have them in place and then know what needs to be on there, right? So within that, the first is identification. You have to be able to identify both the generic and the brand name of the chemical. Like we said, the manufacturer's name, address, emergency phone number, and then the date that this safety data sheet was prepared, because obviously they may be updated. We need to see the composition of the ingredients, right? What all ingredients are there, specifically the hazard chemicals, and within that, what are the exposure limits of each of those chemicals? What is considered a safe and unsafe level of exposure? We also need to include the physical and chemical characteristics of that. What are the freezing and boiling points? What are the appearances and odor of this chemical, so it can be identified and understood better? Fire and explosion data makes relative sense. If there are circumstances that the chemical may cause a fire or an explosion to occur, it needs to be identified, as well as what to do if a fire or chemical reaction and explosion does occur, what sort of extinguishing agents are available for that. Reactivity data as far as what other chemicals these might react to and they need to be avoided and how to properly store those chemicals. And then with the health hazard data, this is going into more depth than was seen before. This includes what the normal routes of entry might be, whether it's through the skin or whether you inhale it. Signs and symptoms of overexposure needs to be included in the health hazard data with that. So that way, individuals would know whether or not they're exhibiting signs and symptoms of overexposure, as well as different acute or chronic health conditions that could result from overexposure, as well as medical conditions that might be aggravated with regards to exposure to this. So, a common one there would be like asthma being worsened by exposure to this specific chemical. Emergency first aid procedures as far as what to do if exposed to this chemical need to be provided. And then the precautions for safe handling and use, as well as control measures. What to do if there's a spill or a leak, how to dispose of extras with there, and then what sort of engineering and work practice controls are appropriate for use of this chemical. So a lot of different things fall within this safety data sheet and the requirements that need to be on there. And so again, these are normally provided by the manufacturer, but it's important to know what all is listed on there and making sure that you as an employee have reviewed these safety data sheets with chemicals that you're working with, and as an employer have provided this as part of your hazard trainings. So that's the last bit regarding kind of those aspects. And now we're going to get into the more specific understanding of what does this mean in reality. Because obviously often we talk about these from writing policies and procedures, but most of the time those are already in place and you have somebody whose job it is to maintain those. In everyday practice, though, we need to understand what this means in real life. So when we're looking at medical asepsis, and this is the noun of decreasing or having a decrease in the transmission of microorganisms. So when we're looking at this, this is the process that goes through, and that process includes different levels. So you see these coming back from before. Cleaning has been eliminated for this purpose because we talked about that last time. So we're going to talk about sanitization, decontamination and disinfection, and sterilization. And so the important thing to understand when we look at this is answering that question, how clean is clean enough? Right? Because ideally, we would eliminate all possibilities for all microorganisms all the time, right? But the only way to really maintain that is in these, negative pressure clean rooms. And we can't be doing that constantly for every individual. So there's going to be some level of possible contamination. And based on how possible the route of infection is, and remember that infection cycle that we talked about, how prevalent that infection cycle is for this specific environment will regard how much cleaning we do. So sanitization is the first step in this, right? And it's going to be the process of removing all of the organic material. So any blood, cells, anything like that, because those microorganisms can hide underneath those organic materials as well and be protected from the other cleaning situations, as well as we need to get to a first place where it is safe to handle these instruments, which is mainly what we're talking about. The next level there is going to be decontamination or disinfection. This is a physical or chemical means removed to destroy pathogens, but it makes them safe to handle, but it does not include killing of spores, and we'll talk about what that means later. And then sterilization, the process of destroying all forms of microbial life, including spores. And the important thing to understand here with this is a continuum. There is a continuum of cleaning. But sterile means that it is free from all microorganisms and spores. So there is no degree of sterility. It is simply sterile or not, right? And so when we talk about sterilization and things that need to be sterile, they need to be completely sterilized, meaning free from all microorganisms. But there is this continuum of cleaning with that. And so sometimes those words get inappropriately used interchangeably as far as sterilization and the process of decreasing microorganism contamination. So how we decide what level of cleaning comes down to this sort of categorization of medical instruments, whether they're critical, semi-critical, or non-critical. And so you can see these, we'll talk about them more as we go through, but critical are going to be anything that enters a sterile body site, so anything that penetrates the skin or the vascular system, right, needs to be sterilized. Semi-critical are things that come into contact with intact mucous membranes or non-intact skin. Right? This is high-level disinfection. We'll talk about what that means. And then non-critical are things that come in contact with intact skin and obviously have a lower possibility of disease transmission, so can be disinfected at a lower level. So let's start with the first process within all of this, and this is sanitization. Right? This is the series of steps to remove any of the organic material and then to reduce the microorganisms to a safe level. So the important thing when we're looking at sanitization, this is basically cleaning. Right? We are cleaning the instruments. It has a few more additional steps in there, right? Basically how you clean that, but you're going to be using at this point detergents that are mainly there to emulsify dirt and oil and to remove large organic material from the instrument itself, not necessarily to kill microbial life. And so these are the steps within that. The first is to rinse that off to get the organic matter off and to prevent it from drying. Then we're going to decontaminate with a disinfectant to make the instrument safe to handle. This is where there's that continuum. There's a little bit of overlap. You'll see this is the same aspect. So we're going to clean some, try to kill some of the microbial life to begin with that. But then we get into the cleaning process and then rinsing. And then we need to lubricate these and check for a working order to make sure that our instruments last longer. When we come to cleaning these, there's two methods of cleaning instruments. A manual method, which is most often used, and then the ultrasound method, which uses ultrasonic cleaning machine and the vibrations produced by the ultrasound machine to loosen and remove the debris. The manual method, like I said, is most common, just using a cleaning brush and solution to get rid of the organic material within there. The ultrasound method has some advantages with that from the standpoint that it does not dull and does not mess up sharp instruments as well, and they do not need to be handled as much with that. Anytime we are cleaning with this, we need to handle the instruments carefully for obvious reasons. And the biggest aspect is you're going to wear gloves. And if you're using, and if you're doing anything with hazardous chemicals or sharp instruments, you're going to actually wear two pairs of gloves. You're going to wear your disposable gloves, and then on the outside, you're going to wear utility gloves that help prevent the puncture as well as prevent irritation. So the disposable gloves prevent the transmission of bloodborne pathogens, and then the utility gloves add a layer of protection. Within that, then you have to follow the instructions on any labels of the chemical agents that you're using, as well as use a proper cleaning agent. You want to use something with a low sudsing detergent with a neutral pH in order to allow for the best cleaning. You don't want a bunch of suds within there that would get in the way. Most of these come in some sort of concentrated liquid or powder, right? And so you would dilute that with that. But it's also important when you're doing this that you never substitute within another detergent, because um, you need to have something that is actually geared towards cleaning medical devices with that. You also need to use proper cleaning devices with regards to a stiff nylon brush is the best thing for most areas with that. You can use a stainless steel brush to get into some of the grooves and crevices. And then you can also use a stain remover if there are stains with that. But you need to avoid anything that's abrasive and could damage the injury or the instrument, specifically like steel wool. You don't need anything like that. And then, as we said, when you're done, you're going to inspect each of the instruments for potential deficits, right? Whether or not a blade is bent, or if the tips don't approximate and tighten evenly with that. Springs should have adequate tension to grasp objects, and cutting edge should be smooth and devoid of nicks. Any scissors should be able to cut cleanly and smoothly, right? And you can test that by just cutting into a piece of gauze, and it should cut end to end without catching. Then lubrication, using a lubricant that can be penetrated by steam, which are commercially available. Right? If not, it builds up on the instrument, and to allow these to last longer and function better. Next is disinfection. Right? And this is the process of destroying pathogenic microorganisms. Again, it does not kill spores, and spores are that resting or controlled state for bacteria where they create situations where they go into a hibernation type mode and protect themselves, so it's much more difficult to kill spores. And then when the environments are right, they then become active again. And so you can transmit pathogens through the spores that then become active in the right situation. So disinfection does not kill spores. That's the main difference with that. Important before you disinfect items that you sanitize them, right, and then dry them before disinfecting, because if they are wet, that would actually dilute the disinfecting more and could make it ineffective. Right? Most of the time we're using liquid chemical agents for this in our medical office, and these are those disinfectants, right? So compared to detergents, a disinfectant actually is used to destroy these pathogenic microorganisms. And we have different levels: high, intermediate, and low level disinfection. High level disinfection destroys all microorganisms with those exception of bacterial spores. You can see some of the different brand names that are used with there, but these are used for semi-critical items. And if you remember back, semi-critical items are those items that come in contact with non-intact skin or mucous membrane. So a lot of the probes, different scopes, different aspects like that would actually be touching these mucous membranes, or would actually be used for non-intact skin but not penetrating the skin. Intermediate level disinfection, right, kills specific bacteria, right, and most viruses and most fungi, but not all. Again, no bacterial spores. Used for non-critical items, most commonly is alcohol. And so these are things that then come in with only intact skin. So blood pressure cuffs, stethoscopes, different aspects like that need to be disinfected at the intermediate level in between each patient. Then you have low-level disinfection that kills most bacteria, some viruses, and some fungi. Obviously does not kill bacterial spores because it's disinfection, not sterilization. And most of these are bleach or a lot of your household chemicals like Lysol with this. And you're going to use these on mainly surfaces with that are not medical devices but may come in contact with different types of skin. So I don't want to spend much time on the types of disinfectants because it's more important to understand what level of disinfectant it is with that. And there are a whole bunch of different brand names with this. The high level disinfectant, Cidex, Metricite, are the most common for high level disinfectant. Alcohol then right, is used for intermediate to low level disinfectants. Right, that's important to know that alcohol is not considered a high level disinfectant, so it should not be used to clean anything as a semi-critical device. It is actually best when it's mixed with water, so you want a 70% alcohol solution with that. And then alcohol wipes can be used on small surfaces that are hard to clean there. Chlorine and all that is the oldest, most common. OSHA recommends a 10% solution of bleach for the contamination of blood spills, and that's the most common within there. And then there are your normal household cleaners as well within there. When we get into these guidelines for disinfection, how you go about actually doing a disinfection procedure, obviously the safety precautions, making sure that you read the all the things we talked about before, as well as the container label, and so you follow all of those precautions. You need to prepare the disinfectant exactly as indicated on the label to make sure that it is able to kill the microorganisms. And this preparation is going to vary greatly depending on the chemical used, whether or not it's going to be diluted or not diluted with that. And within that also is its kill time and how long it needs to be left on the area to kill the microorganisms. And so this is sometimes referred to as the wet time. So most of the time when we're doing disinfectant procedures, if you spray on the chemical, it needs to be wet for at least the amount of time on that that's listed for in order to kill the microorganisms. Otherwise, you're just cleaning, you're not disinfecting. And then with that, storing the chemical and the disinfectant, obviously how you store that will be it will be given by the manufacturer. And it's important to understand the disinfectants lose potency over time. So there are shelf lives as far as how long things can be used, use life with regards to once some things are activated within there, it can only be used for a certain period of time with certain chemicals, and then the reuse as far as how long it can be used before it needs to be changed out for some of the chemicals that you use as far as like chemical disinfecting that we'll talk about later. So moving on to the last one, sterilization, right? This is destroying all forms of microbial life, including the bacterial spores. This is the best level of cleaning that we can do. With that, it is done either through physical methods or chemical methods, and we'll talk about each of those as well. These are used to process those critical items, so anything that is either coming in contact or breaching the skin with regards to like needles, different aspects like that, scalpels, as well, or anything that comes in contact with blood with that. And then also now, most medical offices, it's important to realize, still sterilize most of their semi-critical items. It's just more convenient than using a bunch of the disinfectants with there. And so the only exception then being some of those semi-critical articles that are heat sensitive and must be chemically disinfected. So anytime we can use a sterilization procedure, that is what's best. And the most common sterilization procedure is the use of the autoclave, right? This is relatively efficient and is very effective at killing all microorganisms, including those spores. And the process with this, right, is it's going to use high pressure and steam to get these instruments at a high enough temperature to kill all of those bacterial spores in particular. And so the pressure really just helps to attain that higher temperature, because that's what the real focus is to get that temperature there. So how this works is air is first forced out of the chamber, so that way we can get a higher concentration of steam in there, and as well as to get the temperature higher, because that air is going to reduce the temperature, and that's what we're really trying to focus on. the temperature starts to rise, and then steam is introduced and is going to penetrate all of the material, and that kills all the microorganisms and spores. And then we keep it at a specific amount of pressure and temperature for a specific amount of time, depending on what we are sterilizing. So most microorganisms are killed within the first few minutes at lower temperatures. Spores, however, can withstand a temperature of over 240 degrees for more than 3 hours. So because of that, that's why we get to the 250 degrees for 15 minutes. Even spores are killed at a temperature and this time. So how we go about doing this is how we utilize the autoclave and the sterilization process. So let's go ahead and talk a little bit more about the sterilization process. Like everything else, we have to first start with a monitoring program to so we can track all of these. It's the written policies for each step, as well as the sterilization indicators that we're going to be using. How are we making sure that our sterilization program is effective? It also includes records for each cycle, right? And within that is going to include date and time, the description of the load and the exposure time, so we can keep track of all of that for a period of time, so that way we can keep track of all of this. Most of these autoclaves automatically print this information, so you just type it into the autoclave when you do it, and then it prints it out and you can include it in your monitoring program. One of the big things then within the monitoring program to consider is what sort of sterilization indicators are you going to use? And these are chemical or biological indicators that are used to determine whether or not the sterilization procedure was effective. And so the idea here is a fail-safe to make sure that we are in fact sterilizing the objects, as well as to make sure that we can keep track of that. So when we do this, the main purpose then with this is to make sure that the items within that were exposed to steam at a sufficient temperature for a period of time. And so the indicators then are going to check for proper temperature and duration of time. At least the best ones are. Some of the cheaper ones just test for one or the other. And so the purpose with that is then there's always the possibility of improper wrapping. And so we need to talk about how to wrap the articles to make sure that they are able to be sterilized. And we'll do that here in a second. It's also possible that the loading of the autoclave was improper, and so because of that, we did not get full penetration of steam because it was too tightly packed. So we'll talk about how to load this as well. And then there's always the possibility that the autoclave is not working. So how these things work, the hardest part to penetrate is the center. So you put one of these indicators in the center of the pack. And so that way when you go and open the pack, you will be able to check the sensor or the indicator. And if the indicator says that it's still sterile. If it does not change properly, and usually these will just change colors. We'll look a little bit more about that here when we look at both chemical or biological indicators, then we know that there is a potential problem if they did not change, right? And so if they don't change, we obviously have to go through that. And if it still doesn't work after we've rechecked it, we've tried again, then the autoclave probably isn't working and we need to get it serviced. So the most common type of indicators are chemical indicators, and these just have a certain dye in there that changes colors when it's exposed to the chemical process. So you can see here in the autoclave tape, which is there, it starts off clear, and after it is exposed to steam, it changes color, and so that way you can tell that this pack has gone through the autoclave already. The nice thing about the tape is it's on the outside there. You can easily write on it so you can see what things are with that. And it's useful for closing and identifying the wrapped article. Obviously, the biggest disadvantage is that's on the outside, and so we can't tell whether or not it was in fact sterilized all the way through. So oftentimes it's a combination of both. So that way you can see from the outside whether or not the pack has at least gone through the autoclave. You use autoclave tape on the outside, and then you put a sterilization chemical strip into the middle with that dye. It changes colors. after being exposed to 250 degrees for at least 15 minutes, which kills all of the spores. Put that in the center of the pack. So now you can see from the outside whether or not it's gone through the autoclave. When you go to open it and use the pack, you can then see whether or not steam has penetrated, and actually all of that has been sterilized. Right? And you leave that wrapped until you go ahead and use it. So you can get a double check right before. There are also biological indicators, and these actually then are going to determine the effectiveness. So opposed to just the ability and the fact that you are exposing this to the temperatures, with this you have 2 spore tests that you sterilize and 1 that's not sterilized as a control. And these actually have living bacterial spores on them. And so you put them within these envelopes in there, you take them through the autoclave procedure. You're going to try to put them in the least accessible spot, so in the bottom, near the back, or towards the front, wherever the hardest place is to get there. And then after exposure to the steam, after you run them through the autoclave, you're going to then have them processed. So you can either process them in-house, where you incubate them for 24 to 48 hours, right? You're going to test both the spore tests as well as the control test. And then with that, if the sterilization conditions have not been met, the processed spores and the control spores will be the same color. If not, if it was successful, then the spore tests would be one color and the control would be another color. More commonly, though, is to mail it in, where once you've done that, you then mail them in, the results are mailed back. But obviously that has a bit of delay. So it's recommended that at least once a week you use a biological indicator to see whether or not your autoclave is functioning properly. So I hinted at wrapping, and so the purpose of wrapping here is to protect these sterile articles from recontamination. So there are different techniques and different products that you can use with this. But the idea here is first you have to sanitize and clean the instruments. You're then going to pack them in a very specific way, and we will look at this in lab on how to do that, so that way you can create a situation where steam can penetrate the pack, but you can also open the pack without touching any of that stuff. All right. And this prevents dust, insects, microorganisms, or anything to continue with that. And so the idea with this here is, once we create a sterile environment within the pack itself, unless something happens, it will remain sterile. But we can't do that if there's a hole or it's torn or anything like that. So the 3 main common things are sterilization paper, comes in squares of different sizes. The nice thing about it is it's relatively inexpensive and it's disposable, so it's easy to work with. The problem is obviously you can't see through it, so you can't see what's in there. And then it has this sort of memory, so after you fold it, it tries to stay folded with there. So when you open it up, it will fold back in on itself, which can become problematic. Pouches are the easiest. Basically, they have different types of pouches. Most of the time they're clear on one side, so you can see in there. They have labels, so you can write on there. The only problem is they're one and done, and so they can be more expensive in there. If you want a really green thing, muslin will work as well. It is a reusable woven fabric. And it's really flexible and easy to handle, and you just have to clean it in between aspects. And large packs with that sort of aspects work, and then you can use that as a sterile field, which can be really nice when you open it. As far as operating the autoclave, we will go over this in lab as well, but it's relatively simple. There are automatic and there are manual autoclaves within there, and so understanding how that goes through. But basically, it's going to be some sort of filling with water within that, setting the timer to allow for the appropriate amount of time. Like I said, if there are different aspects, there are some reasons you might need to increase the pressure or the time with that. If it is a manual one, it's important that when you set that timer, that it is not until it's actually full. But let's get to some of the more practical stuff. Loading the autoclave, pretty simple with this. You need to load it in a situation where steam can penetrate easily. So smaller packs are better. You need to loosely pack the autoclave so that way steam can get in between. If they're all bunched together, obviously steam can't get in between there, so it's harder through there. Glass and jars should be placed on the side so that way no air gets trapped in there, which would then make it more difficult to sanitize, as the temperature would not increase as it should. Right, and you should also put things in a vertical position as much as possible, right? And then pouches with their paper side up and plastic side down to allow for steam penetration. As far as timing the load, like we said, most of the time operated at 15 to 15 pounds of pressure, 250 degrees. Automatic ones will simply do it, all of this on their own. More are the manual ones. If you need to set the timer, once it reaches the temperature, you can go ahead and set the timer. You can see most time 15 minutes for hard non-porous things. If there are large packs, you would want to increase the time to make sure that everything at least reaches that 250 degrees for 15 minutes. Right? Because as we know, articles are not sterile unless they've been subject to the steam for that proper length of time and at the proper temperature. After that, because we are using steam, we have to dry the load. So because these are still moist in there, the microorganisms can actually move through that moisture on these wet wraps and contaminate the sterile articles inside. So what ends up happening there is they're going to be vented of the steam first. Most of those do it automatically. And then either manually or automatically, you need to open the door a half an inch. If you do too much more than that, you get condensation, but you just need a little bit so that way the air can exchange and that moisture can go from a liquid to a vapor, right, and exit. Drying time is anywhere from 15 to 60 minutes depending on the loads and once they are dry, then you can get to the point where you can store them. And so when we get to this, we're talking about what we call event-related sterility, which is basically the pack is sterile for an indefinite period of time unless something happens, right? So that's the point and why you wrap it, so that way they can stay sterile until you go ahead and use it, as long as it doesn't get crushed or dropped or compressed in any sort of things with that. Obviously, the more you handle the packs, the more possibility for one of those events to occur. So it's recommended you handle the packs as little as possible. And then with that, you want to store the packs in clean, dry areas, obviously similar to, trying to prevent the things that microorganisms like to grow in. And then you want to use the most recent sterilized articles in the back. So it's one of those, the oldest sterilized package should be in the front, so that way it gets used first. And so that way you don't have something sitting in there for years and years and years. And then before storing it, you need to check to make sure that there was no damage to the pack itself. And so then it will stay sterile as long as something happens when you go to open it. There's the procedure for opening it that you learn in lab, and you have sterile instruments. So there are some things that cannot be done with an autoclave because they can't use steam with there. And so if an article cannot have steam in there, or it's damaged by steam, then we would use something like a dry heat oven. It's much less corrosive than moist heat, which is good for sharp objects because it doesn't dull their blades. The main problem with this is there's a much longer exposure time required and a much higher temperature required in dry heat compared to moist heat. And so you'll do similar sort of things, but now in this dry heat oven, 320 degrees for 1 to 2 hours, and you can really use any oven with that as long as you can control the temperature with there. Wrap it in a similar way with aluminum foil, and there are dry heat indicators as well. There is gas with that where you can use a specific gas sterilization process for some of these. And these are really used in the manufacturing process as well as radiation. So I'm not going to talk much more about that because it's really just part of manufacturing. So if you buy sterilized things, it may have been sterilized either with a gas or with radiation. But the other aspect that is sometimes used is cold sterilization. And so in cold sterilization, what you do is you have a sterilizing agent and you completely submerge the item in there for 6 to 24 hours, depending on the manufacturer's recommendation. Right? And then it stays in there during that process in order to stay sterile, because you can't take it out because then you're touching it, obviously, with that. So if you leave your instruments in there, it can actually damage that. In addition, it's important to understand that if something is removed or added, the clock restarts for everything in there. So if you have a sterilization container that you use for cold sterilization and you remove an instrument, everything in there then has to go through the entire sterilization process again for the time needed. And so that makes it much more difficult and much less commonly used and available for that. And so the only reason to use cold sterilization if other methods are not indicated or they're not available. And so sometimes in athletic training, we don't have an autoclave or anything like that. So we use a cold sterilization procedure. And lastly, radiation, and I talked about this using high energy radiation in manufacturers to sterilize prepackaged material. So that is the sanitization process as far as how we go from cleaning all the way to sterilization. Understanding the different components within that is important, while at the same time also understanding the variety of different cleaning options that we have and what is most appropriate for each situation. So as always, if you have any questions, let me know. Otherwise, have a great day.